Welcome everyone. So it's a case about 36-year-old woman who came with the presentation of fatigueness and malaise over the past several days. So the patient has had no significant infections and also she does not appear to be in acute distress. So after her initial evaluation, she has been suspected with TTP, the thrombotic thrombocytopenic purpura. So the suspected diagnosis has been given. So the lead question is checking about which of the following finding is essential in making the diagnosis of TTP. So basically they are checking you the diagnostic criteria for TTP, right? So look at the choices here. So abnormal neurological examinations, elevated blood pressures. So we'll rule out one by one. So hypertension, it's not a manifestation of a TTP, so we can rule out this. So TTP, there is no hypertension. And the neurological examination. So before going to the neurological examination, so we should know what are the symptoms of TTP and why we should know about TTP. TTP has higher chance that the mortality rate is about 90%. So even we can prevent the death of the patient if we can diagnose the case at right time, right? So what are the symptoms? What are the criteria for us to make the diagnosis? Fever, neurological symptoms, kidney disease, MAHA manifestation, and thrombocytopenia, right? So here we'll rule out the first option, the abnormal neurological examination. So the abnormal neurological symptoms can be there in TTP, but remember the fact it can be seen in only 2/3 of the patients, right? So only 2/3 of the cases have this neurological symptoms. Not necessarily all the patients will have the neurological symptoms. So it is not the essential criteria. And again, the symptoms like fever, renal failure, again, like it can be seen in 50% of the cases. Not all the cases of renal diseases will have TTP manifest. Not that all the cases of TTP will have the renal disease manifestation. So it is not the essential criteria for you to make the diagnosis. So this is about 2/3, right? And the next manifestation, fever. Fever is seen in about like 1/5 of the patients only. The fever manifestations will be there. So again, it is not the essential criteria to make the diagnosis of TTP. So we can rule out this as well. So fever can be seen in 1/5 of the patients, right? So we can rule out the fever as well. And look at the other choices now. So the hemolysis, the hemolytic anemia, elevated liver enzymes, and also yes, so this can be patient is having a thrombocytopenia, so and also hemolysis and elevated liver enzymes. So what we will think about? We'll think about the condition called HELP syndrome. So again, look at the clinical vignette. So HELP syndrome can be seen in a woman who is having a presentation of severe preeclampsia or eclampsia presentation. So it is usually seen in the pregnancy. So HELP syndrome can be seen in pregnancy. So the pregnant women with previous or pre-existing preeclampsia or severe eclampsia, yes, you do have this presentation of HELP syndrome will be there, right? So it can't be the HELP syndrome. So HELP syndrome also you do have thrombocytopenia, even MAHA presentations will be there, but the clinical vignette is not matching. So here it can't be the HELP syndrome, right? So by looking at this, so what is the right choice for us, like for the present patient? What is the essential criteria for us to make this diagnosis? Yes, so it can't be HELP syndrome, but definitely the patient is having some sort of hemolysis is happening here. So we can rule out this, the choice C here, the elevated liver enzymes and thrombocytopenia, and along with hemolysis can be a part of a HELP syndrome, but which is usually seen in pregnant women with previous pre-existing preeclampsia or severe eclampsia. So we are ruling out that choice, but for sure TTP will have the hemolysis will be there. So the hemolytic anemia. So considering the choices what we have, so hemolytic anemia is the likely presentations, the essential criteria for us to make the diagnosis of TTP. And also apart from this, we can do the ADAM TS13 activity. So to confirm the diagnosis, you can check the ADAM TS13 activity. So what is ADAM TS protein or the enzyme? So this ADAM TS enzyme is essential for you to break down the large von Willebrand factor multimers. So VWF multimers will be breakdown by this ADAM TS13 protein enzyme. So whenever you have a TTP, this ADAM TS13 activity will be decreased. So TTP, the activity of ADAM TS will be decreased due to antibodies circulating in the plasma, maybe due to autoimmune reason, right? So this can be treated. That is the reason whenever you want to treat a case of TTP, we always rely on the plasma exchange. So treatment can be done with help of plasma exchange. So plasma exchange or plasmapheresis will be very helpful for you to achieve the 100% remission. So that's about the case of a TTP, the thrombotic thrombocytopenic purpura, where the chances of mortality is more than 90%, and we can prevent that simply by the plasma exchange, which will be helpful for us to clear up the antibodies against the ADAM TS13 protein, and so that we can improve the symptoms. Thank you.